Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Anae Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you will have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey Vet Rehabbers, in today's episode we're diving into a presentation from our annual online conference, the Vet Rehab Summit. This year our theme was Ethical Dilemmas in Veterinary Rehabilitation. Ansi from Walt challenges our perceptions of placebo, exploring its impact on therapy and our rehabilitation outcomes. She also highlights the critical role owners play in their pets' recovery and how their beliefs, including fear avoidance behaviour and self-efficacy, can influence the effectiveness of our therapies. This conversation is really going to get you guys thinking. Now, if you're looking for some free online learning, we've got you covered alongside our membership, which includes 500 hours of vet rehab specific content for equines, small animals, and hydrotherapy. We also offer free webinars through our limited access membership. The latest updates include the biomechanics of agility by Ariel Pachet-Markley, capitalizing on canine cognition during hydrotherapy by Ansi van der Walt, and returning the equine athlete to work after injury by Lee Clark. If you're interested in any of these, you can go to onlinepethealth.com/free to sign up. If you're an Online Pet Health member, these are in your membership already. Now, before we head over to that chat, a quick word from our sponsor. Nadia first developed her courses at the Colorado State University, where she started the Medical Acupuncture for Veterinarian Certificate program in 1998. In so doing, Dr. Robinson developed a science-based platform for veterinary acupuncture. It was the first of its kind. Today, Curacao Vet offers a comprehensive curriculum in integrative medicine with a rational, evidence-supported foundation. Their courses include medical acupuncture, photomedicine, botanical medicine, medical massage, as well as integrative rehabilitation. And if you want to find out more, you can go to curacao.org. Right, let's hear what Ansi has to say.
And I'm going to hand over to Ansi. Without any further ado, it's over to you.
Brilliant, Michelle. Thank you so much. It's so nice to be here and being with Online Pet Health again. It's such an exciting lineup for this afternoon, and I think we're going to be able to have really, really valuable discussions about very important topics. So I'm excited to kick it off with this one. Because placebo treatments is something that we can't avoid as vet rehabbers. It's something that forms part of everything that we do with our patients, and the better we get at understanding exactly the role that it plays in our care of our patients, the better. And of course, the important thing is once we understand it, how do we make sure that the way we integrate it into our practices is ethical? All right, so let's have a look at some definitions. So generally, a placebo is defined as something that's inactive or inert. All right, so that suggests that it doesn't do anything, or it's a simulated medical procedure that's kind of designed to look like the real thing, but not do anything. And that's why it's commonly used in clinical trials to kind of compare the thing that or the treatment that we think is going to have an effect with is something that we are assuming has no effect, so we can see whether our thing that we're trying to test really works. But it's very important to consider whether there really is such a thing as a placebo effect, and the clue is really in the name. There is always an effect of anything that we do with our patients. And our understanding of what placebo really is evolving, because it's a far more complex concept than just something that essentially does nothing. And as research is going on, we're starting to understand more and more that it is not what we used to think it is. And one of the most significant things about placebo is that client expectations, and that includes our animal patients, their perception of the situation, their whole experience of the interaction with you as the therapist and the therapeutic environment, has a significant therapeutic effect that not only we need to take into concern, but that we potentially should be leveraging to get better results for our patients. But the underlying mechanisms are not that well understood yet, and it's something that's becoming more and more of a topic of research in the human medical field, but it's something that we really, really don't understand in veterinary science at all yet. So there's quite a lot of research to show that placebo actually does do something. And even placebo-controlled clinical trials, which are supposed to be the gold standard of how we run a clinical trial, actually don't work the way we thought they worked either, because unless we really understand what the alternative or what is called the placebo treatment does, then it's difficult to control for the effect it has in our clinical trials. And it can be really, really powerful, and we'll get to that later, and even in our veterinary patients. So this means we have to have a really big rethink about placebo, whether there really is such a thing. Some commentators suggest that the whole world of the word placebo is redundant, because it's everything we do has an effect. So maybe the word placebo needs to be retired. All right. But placebos can also work by proxy. All right. And it's something that I always come back to, is so important to always consider who is the party that brings the dog or the cat or the horse for treatment. Who's the one who seeks care? And generally that is not the animal. The dog doesn't drive himself to the physical therapy practice. The owner or the client or the caregiver is really the one who is experiencing the distress or the concern about their dog based on something that they are seeing. And this is causing the owner to adopt a certain behavior or change their behavior and decide that they must do something about this to help the animal feel better. So placebos can also cause behavioral changes in the owners of the pets who believe in the effectiveness of a treatment. All right, so they may, if a owner brings a patient to a physical therapy practice and they see you doing a treatment and they're really impressed by it, and they also believe that this is going to be very effective, it's also going to change the way they experience the treatment and the way they may interact with their dog when they go back home, because they think, something's really helped the animal now, so everything is going to be better. And this has a emotional as well as a psychological influence on the owner, because of these positive expectations and emotions, and that often changes the way that they interact with their animal. So they may be a little bit more positive about letting the dog have a bit more exercise, or they may feel a little bit more engaged and committed to the home exercise program because they're feeling more positive, because they believe that their dog or their cat has had a treatment that's been really effective. The way we communicate about our treatments also have this effect on how positively or negatively the owner may view the treatments that we've given them. And again, this is going to have an effect on their husbandry of their painful or ill animal. And as soon as there are more positive experiences associated with a treatment, this has a learning and a conditioning effect on the behavior of both the caregiver sometimes as well as the animal. So they become a little bit more accustomed to being more active, and they become more accustomed to be expected to go on little walks again or getting onto the couch again, because the owner now believes that a treatment has been beneficial, and they are more likely to be encouraging of more active engagement with their animal and more activities and in the home. So we have to always remind ourselves that just because we don't understand the mechanism through which something works does not mean that it has no effect. It just means we don't completely understand how that effect works. And behavioral conditioning plays a really, really big role in how we get effects through rehabilitation, because we help our patients adapt functionally. And a lot of that we do through graded exposure, so gradual positive movement experiences, gradual positive experiences of manual therapy, positive experiences around interacting with things like steps and stairs and getting into the car again, so that the dogs also start to believe again that they can actually achieve these activities when they have previously learned that certain behaviors might have increased their pain. And placebo analgesia is a thing, and it's a measurable thing, not easily measurable, but it works through very specific and well-known neurological as well as physiological pathways. In the notes, I've listed all the neural pathways, but it's both central, so it's the brain, it's the spinal cord, and it's also changes that happen at the periphery in the nervous system through gone blank, of course, the interstitial nerve tissues. All right. And then also very potent physiological effects, such as oxytocin release, beta regulation of cortisol, activation of the endocannabinoid system, and modulation of prostaglandin synthesis. So we know that prostaglandins play a role in enhancing the inflammatory response. And if we've got something like arthritis that causes a chronic low-grade inflammatory response, the more effective the system is at modulating how much prostaglandin gets released in and around the arthritic tissues, the better the body is able to regulate its own pain response. All right. So these are known pathways of pain modulation that exist and are testable, that are activated through placebo effects that can cause analgesia and even cause more pain, which we will get to towards the end of this talk. Okay. So this is normally, it's a little bit of a busy slide, but generally, let's say in the example of an osteoarthritis patient. So we've got a dog that comes to us with a diagnosis of osteoarthritis, maybe in one or usually multiple joints. And we have ways of measuring the dog's pain and their functional ability. We might have some x-rays to show how badly the joint is affected, and we will do our physical assessment and measure range of motion and pain on end of range position. We might have a look at how well the dog is able to transfer weight onto the limb or load the limb, and we normally do that by gait assessment. And then we're going to apply some or other treatment and combination of treatments, and then we want to see that there is a change in that dog's physical ability, which if we are very good and disciplined, we will measure by using the same client-reported tools again. But there's a whole step in between that, and that's where the owner comes in as a mediator. So how the owner perceives what's going on with their dog, or their cat or their horse, has a really big effect as well on how effectively they do the things that allow the animal to adapt to their new physical status. All right. And whether that is their commitment to their home exercise program or how regularly they bring the animal in for their treatments, these are all things that have an effect on how successful our treatment outcomes are. So again, what this highlights to us is that we have to address not only the issue in the tissue, which is what we are generally trained to do, improve range of motion, improve muscle strength, reduce pain, but we also have all these other secondary effects that have a huge role to play in the outcome of our treatment plan. And here's another slide that illustrates that. Generally, there's something that causes pain that maybe will cause let's use the dog as an example. So there's pain in a stifle joint, so the dog experiences that as uncomfortable, so they will start limping. So that limp is seen as a change in behavior by the client. And if they are very anxious about this change in behavior, like the limping or not being able to get into the car again, they may not know what to do and stop encouraging the dog to move and become very scared of movement. And in that way, they amplify avoidant behaviors in the dog. All right, so they almost increase the dog's avoidance behavior more than it needs to be. All right, and this leads to more functional disability. However, if the pet owner or caregiver is not so very anxious about this change in physical behavior that they're seeing, they may feel more like they can help the dog improve. They're more likely to follow advice, be adherent to a home exercise program, help the dog better adapt to any changes, either in the short term or the long term, depending on the condition. And you end up with a dog that has better functional ability. All right, so that's not as disabled. Hope that all makes sense. Remember to jot down any questions you might have, and we can come back to this. All right. So there's obviously some ethical pitfalls with placebo. All right, so we want to do things that will make the owner and the dog feel better about everything that's happening to them, regardless of necessarily the mechanism of the treatment that we're using. But it's really important that we don't allow a placebo treatment or a approach that's targeted mostly at perception and emotion around the treatment and the situation to allow a situation where either you or the owner disregard symptoms that do need to be addressed. All right. Because placebo does not have an objective measurement. We have no way of knowing exactly what the effect size is. So we always have to make sure we balance any, let's call it positive thinking approach with objective measures as well, so that we're not missing anything because we're trying to remain really positive and enthusiastic about where our treatment plan is going. Because if we miss things, it can delay effective treatment for things that do need to be addressed. And that has an implication for animal welfare. But as we'll see later, animal welfare becomes really complicated in the context of placebos. All right. We also need to make sure that where we allocate clients' resources, as well as our own resources in terms of time in the clinic, needs to go to the thing that's going to have the biggest effect size. So if we are using treatments that may have some effect, but the argument is that perhaps the dog enjoys it and the client really likes it when we do laser on their dog, but it may not have as much of a effect size or a treatment result as another treatment we could choose to use in the same time and at the same cost, then that is something that we need to weigh up. We also need to weigh up the client's expectations of what can be expected from a certain treatment modality. So if we are going to use something that may be positive, but may not be the most effective treatment, we need to help clients understand exactly what to expect from it and why we are choosing to use that particular treatment at that time. And we'll talk about legal accountability a little bit later as well. So it's not enough to say, oh, well, we understand now that placebo has an effect. It can be really positive. So we should always use that in all cases. We need to weigh up a lot of different factors when deciding on our treatment approach. But it can be really effective. And we know that from veterinary studies as well. In treatments where they've tried to use placebos for comparison to medications that we know have a positive effect on pain and lameness in dogs with osteoarthritis, almost 40% of people saw an improvement in their dog's lameness, even though they were on the placebo. And that's huge, guys. If we can increase our treatment effect of pretty much anything by 40%, that is huge. All right. And that can make a massive difference to our patients' quality of life. So we certainly can't discount the effect of placebo. In cats, they have also seen a huge effect of placebo treatment, and cats even more, up to 74% in some cases. CSOM is client-specified outcome measures. Okay, so if a client reported that the cat was no longer able to jump onto the counter to get to their food, and now they can jump onto the counter to get their food. And most of these studies are medication trials where they use say, an anti-inflammatory or an analgesic with known effect against a sugar pill, essentially. And it's really potent to think that without anything that we consider as a treatment that would have an effect, we will see a positive outcome in between 40 and 70% of cases, right? So we have to try and understand the role of placebo better. In rehabilitation, placebo also has a really big effect. So we don't really have the data on this in veterinary rehab. So most of the studies investigating placebo in rehab is from human studies. But that one on the left, it says pain can be reduced both by isotonic exercise. So we know that isotonic and isometric contractions reduce tendon pain. So it's a known treatment for tendinopathy. But also, if the participants in the study had positive expectations of their rehabilitation program, that was enough to reduce their tendon pain. And when it comes to manual therapy, very similar results have been found. So your massage, your joint mobilizations, it is considered now by some researchers that placebo and contextual effects might be the primary mechanism through which manual therapy works on pain relief. So you might want to argue at this point that we are treating animals and they don't know what the treatment is supposed to do or meant to do. But dogs pick up a lot from the environment and the context as well. They can definitely have social synchrony, which is the ability to match their emotional and physiological regulatory state with that of the humans around them. So if the therapist and the owner in the room are both feeling really calm and positive about what's happening, it is very likely that the animal will also have a positive association with whatever is being done to them. Not in the cognitive way that a human can, but in a cognitive experiential way. So that how that happens is a whole another talk by itself. In studies of Pilates, and I haven't included that study on this slide, but there have been a whole lot of mediation studies done on exercise and rehabilitation through Pilates. And the data is starting to show that potentially the bulk of the positive effect gained through Pilates are also through contextual effects. So the positive experience of getting a lot of feedback and reassurance from the instructor, and being made aware of your body and improving the body awareness, rather than the actual strengthening and mobilization effect that is achieved through that exercise. So here's one of the examples of where I think I use placebo sometimes in my practice. If a new patient comes in that is very, very reactive and anxious about being touched and nervous about the situation, and I find that they trying to palpate them and trying to do massage and manual therapy on the painful area actually increases their anxiety and their guarding response, then that doesn't really help the patient, because we're just increasing their negative bias towards any movement of the leg, or we're increasing their anxiety as it regards the area that's already painful, and it's not really helping me achieve any therapeutic effect with my treatments. So what I will often do is I'll use my laser to any area that the dog is happy to tolerate calmly and happily, hopefully taking some treats in the process. That's as close as I can get to the painful area. And in that case, the physiological effect on the target tissue is obviously zero, because I'm not targeting the tissue that I think is the problem. But I am providing graded exposure to both the therapeutic setting as well as the equipment, and getting the dog accustomed to all of this stuff in a way that I can make a positive experience. The laser is a fairly neutral object. It doesn't have an existing association for the dog for something that is going to be painful. Quite often, by the time that they get to the rehab practice, they're already expecting that somebody is going to move their painful area and it's going to hurt. And they don't have that expectation of a laser probe. So it's a low sensory stimulus that we can gradually accustom them to, and we can pair it with something positive like cuddles or a treat or a licky mat or a nice chewy thing to also release dopamine. And that helps to trigger endogenous pain modulation through all of those neurological and physiological effects that we discussed earlier. So while in this case, you can argue that I'm not treating the painful area, I'm still treating the dog's pain by activating all of those descending nociceptive inhibitory pathways and reducing the dog's anxiety and pain experience. So I am having a treatment effect, even though that treatment effect is not the one we typically associate with the purpose that we use laser therapy for. So just remember that anything that we do or get the client to do has some effect. Nothing ever has no effect. So the more clear we can be about the effect that we're trying to achieve, the more we can use all our treatment approaches effectively. So if we can define who our treatment is helping, and remember that can be both the patient, the dog, the cat, the horse, the hamster, the guinea pig, or it can be the owner. And treating the owner is equally valid as treating the patient is. And define why it is helping. Understand why this is a good thing to use the resources, which is your time and the client's money for, and what is the cost-benefit balance. And you have to be transparent and honest with the owner about what your goals are with the treatment. So don't try and convince the client that you're doing something that you know you're not actually doing, but explain to them why you are selecting a particular treatment approach that may not currently have a direct effect on the painful area. For me personally, when I do something for let's call it a placebo purpose, which again has a specified and very particular purpose, I won't charge extra for it. So it'll be included in my treatment session, but I'm not going to charge an additional fee for something that is not being used for its intended prescribed purpose. Right? And as long as there is no risk of any adverse or negative consequences for the patient, and I've done my weighing up of the pros and the cons, and I'm clear on my reasons why I am choosing this treatment approach, then I feel ethically justified in continuing with this treatment plan. So the little photo that I've put there is a little puppy that was born with a skeletal deformity, angular limb deformity. It wasn't able to place the paw down. And it was an interesting journey because this was a litter that was bred by a vet. And we were going backwards and forwards about how we should be managing this. And one of the specialists that she spoke to suggested that it would be okay to just leave it. It would come right by itself. But we elected to do a little bit of splinting and taping and just positioning of that back leg to assist with normal proprioceptive input through the pad. And what I put down at the bottom there was the ultimate conclusion by the vet who owned this litter. And she said, look, either we treated the dog for the problem presented, or we treated the owner, me, by giving me something to do. And much as though that can sometimes sound a little bit flippant and like it's not really serious veterinary medicine, it's actually really important for all the reasons that we have discussed up till now. And we really have to start looking at the owner or the caregiver as a much bigger part of our considerations when we approach treatment of our patients. So we can't really discuss placebo without discussing nocebo as well, which is kind of the opposite. It's when negative expectations or beliefs about treatments or about a condition leads to worse health outcomes or negative effects of treatments when it actually doesn't need to or it shouldn't. Right. So nocebo also happens through psychological mechanisms. So anxiety is a big one. We need to be very, very careful about the amount of stress and anxiety our patients experience during treatment and when they come to the clinic and the whole experience in the clinic and during the application of many of our modalities. But stress and fear in animals can also be influenced by the attitudes and the behaviors of the owners. All right. And this also happens through physiological effects. And there's also neurochemical mechanisms by which nocebo occurs. So cortisol and pro-inflammatory cytokines definitely do not help us get to where we want to with pain management and rehabilitation. So it is also equally an ethical responsibility of the vet rehabber to reduce nocebo as much as possible. And we can't ever ignore that component. All right. So some of the factors that contribute to nocebo in our rehabilitation clinics are the attitudes and the behaviors of the client, the owner who brings the dog to the treatment. We've said this a couple of times already, but if the owner is anxious and has negative expectations, this is going to affect not only how the dog or the cat experiences the treatment session, but it will also affect how committed they are to the treatment plan that you prescribe. And nocebo can be influenced by past experiences. If the patient has had previous negative experience with therapy or with their joints being manipulated or mobilized, and they were perhaps very painful during a session or very painful after a session, both the animal as well as the owner is going to learn from this and start to develop a negative association with it. And then obviously there's a lot of environmental stresses. Not all dogs are that used to being carted back and forward in a car, and especially in South Africa, not all dogs go places a lot. So it can be quite stressful to go places. Just the trip in the car could be a nocebo factor. And then how is your clinic set up contributing to their stress and their anxiety? And also, are your systems at your practice set up in such a way that you set the owner at ease as much as possible? Yeah, and that often involves constantly explaining what you're doing, explaining the purpose of what you're doing, and most definitely if there's going to be a negative reaction by a dog potentially to a test or a treatment, you need to warn the client about that so that they aren't caught off guard if a dog suddenly yelps or cries. Okay. So like I say, we have a responsibility as veterinary professionals to limit the nocebo effect, both from a welfare point of view, because we have a responsibility to reduce suffering and enhance quality of life. We have to adhere to ethical standards of the treatment of animals. And we also want to make sure we build trust with our patient as well as the owner who brings the patient to us. It also enhances our treatment outcomes so we can optimize the rehabilitation process for the patient by promoting recovery as well as we can. So again, go back to a 40 to 70% positive effect that we can get through placebo. All right, we don't want to miss out on that potentially for our patient. We also have a moral obligation to provide the best possible care to our patients and provide care that is compassionate and done with empathy. All right. And the acronym LIMA is always something that we have to have in the front of our minds when we approach any of our treatments. Do the least intrusive or invasive thing that you can possibly do that's as unaversive as possible. All right, so you want to have as many positive experiences for your patient as well as the owner as you possibly can, because that is an ethical obligation, it's a welfare obligation, but it is also your responsibility as a rehabilitation therapist to get the best possible outcomes for the dog. And it is hard because often the things that we do aren't comfortable. The dogs are often in pain, so it's not possible to do things that are not intrusive at all and not aversive at all, but we want to minimize that as much as we can. So, in conclusion, hope you guys have lots of questions. Managing both placebo as well as nocebo effects in our rehabilitation practices is a critical ethical responsibility that we have. Placebo can be very beneficial, very, very beneficial, and I would argue even crucial as a part of our treatment plans, but we have to be transparent in how we communicate what we are doing to the clients, and we must still rely on evidence-based practices as much as possible. So we don't want anything to slip through the cracks because we are forgetting about the basics that need to be in place. Minimizing nocebo is important to prevent unnecessary suffering and to enhance recovery. And there's a lot of things that we have to balance as veterinary professionals in considering all of these different elements to maintain high ethical standards that are balanced with evidence-based care. Okay, so that's that. Let's see about some questions.
As always, Ansi, your lectures actually blow my mind because you bring such a different perspective to a different thought process. And I really appreciate that. Thank you. So Tanya, thank you for joining us live. Guys, it's amazing to have you all here with us live today. Tanya says, I've been treating the clients for many years. It's wonderful to see the science behind what I intuitively do. Love it. So treating the clients. I like that. Thank you, Tanya. And Annie, thank you for joining us. She says, will you suggest that we explain this mechanism to clients to give the patient the best benefit for optimal recovery and pain management? That's an interesting question.
And absolutely, I think we absolutely must. We have to get comfortable, and I love that, Tanya, and I think that's those of us who are finding a lot of success in what we do, I think will all have experienced that the better our relationship, our therapeutic relationship with the client is, and the more we seem to get really good results. And that sort of is, as she says, now being backed up by the evidence and the data that's coming out. But yes, I would say that we have to get away from placebo as being kind of like not a real thing. You know, and I think if we sort of wondering whether we must explain it to clients, we feel like maybe it's not a real thing and it's all in our head. That's what placebo used to be. You know, it's like something's all in your head. And it's not, it's a real thing. And the more we can use it, the better. And the more the client understands that the power it has to make their dog's life better, the more they're going to get on board with it. And as rehab professionals, we spend a lot of time with the owners. And we have a responsibility, I think, to start really looking at the dyad, the patient and the owner as one unit, and really bring the owner in as a partner in the treatment plan. And if we as rehab professionals start to understand and leverage the power of placebo, our partners in the dog's care, which is the owner, should also be doing that, which they can only do if they understand it. So 100%.
I really like that. So for me, that kind of makes me think we should change the language around placebo, right? Because we have this understanding that it's an inert or an inactive thing that we're doing that doesn't have an effect. But if we change the way we understand that, or we use a different word, we could tap into that positive impact without eliciting that feeling of, oh, you're doing nothing, potentially. Michael, thanks for joining us. So Michael's question is, some of the therapy is empathy and compassion to treat the negative emotional impact on the caregiver or owner. This certainly helps empower them to be positive and a proactive partner of rehab.
I love that, 100% correct.
So the part that we don't want to acknowledge as professionals, right, where we have to treat the client as well as the patient. I love that. And then we've had a question or a comment from Andreen in the chat, which I think it would be great to go into. So you mentioned during your lecture that a lot of the effect that we might be having with manual therapy might actually be attributed to placebo. Could we go back to that and go into that in a little bit more depth? Because that, is it because we don't fully understand our mechanisms of action? Let's chat a little bit more about that one.
Probably. So, I mean, that's been a huge topic of research in human rehabilitation of late, actually for quite a lot of years now. And that's been one of the big drivers why in some areas physio has gone more heavily weighted to rehabilitation, you know, physical exercise and therapeutic exercise based rather than hands-on and manual therapy. But I'm a manual therapist. I love my manual therapy, and I'd like to convince myself that I am having a mechanical effect. But it's been very difficult to really demonstrate those mechanical effects scientifically. And it has been quite consistently demonstrated that the contextual effects of manual therapy have a a big effect. But I think it's realistically a little bit of both. We are stretching tissues, we are improving movement in a joint through our accessory joint mobilizations and stimulation of the mechanoreceptors. So there is a neurophysiological response, at least, if not a mechanical response. But all of that is very unlikely to be as effective if we're dealing with a dog that's really tense and very stressed about what we're doing with them. In fact, probably the bulk of manual therapy is happening through descending pain inhibition. And you only get descending pain inhibition if you get serotonin release and dopamine release. And you're not going to get that if there's this massive cortisol flash happening in the dog's central nervous system. So it's both, but I think probably you are also not achieving the neurophysiological or mechanical effects that you're hoping to achieve if you're not getting the psychological and emotional positive effects at the same time.
Awesome. So Demi, thank you for joining us. Thank you very much for the great lecture. Thank you also for shedding so much light on the nocebos. Yes, I have many patients who take refuge in placebo treatments, and also many therapists who consciously or unconsciously use placebos, but many forget how harmful the nocebos are, and that are actually associated with any placebo. Yeah, I think thank you for bringing up the nocebo, because I think that brings up thoughts for me of, my own beliefs and expectations and what I'm bringing into a session. And, sometimes we're treating dogs or horses that have a mountain of things wrong with them, and that can bring our expectations to the table, which are not the client's or the horse or the dog's expectations. And I think that's a good thing to guard against.
No, 100%. 100%. And I think it's also one of the things that can go wrong in practice is that we feel a responsibility to give the client value for money and, make sure we do a lot in the session so that they don't feel like, it was a waste of their time driving 40 minutes to get to you and the 45 minutes there. But often trying to do too much, you can often get more beneficial physiological effect and pain relieving effect by just sort of being a therapeutic space and being a place where good things happen and nice things happen, even if you don't feel that you really made that much of a difference mechanically or biomechanically to the patient on that particular day. It's an investment. But the client does have to be on board with that. And you need to explain the negative effects of stress and cortisol and why we need to gain the dog's trust. So always just see the owner as your partner and communicate with them. And I think one of the big things that is really highlighted by all of this is the biopsychosocial model of pain. The bio is the arthritis or the tendinopathy or the, hip dysplasia. But the psychosocial is the interaction between the client, the patient, and the environment. And our practices as part of that environment, our treatment techniques as part of that environment, and how we approach the patient and how we apply our treatments is part of that environment.
Fantastic. So Ali's comment here ties in with that. I often end up working on behavioral issues, enabling the dog to make choices, giving him a voice and confidence. And then the rehab training has so much more effect. It kind of plays into the placebo effect in a sense of looking at the whole picture.
Absolutely. Love that. That's a great way of approaching it.
Awesome. And Rachel says, absolutely 100%. Our language and communication is so very important. I use the word orientation instead of initial assessment, like that.
That's very nice.
And the difference it makes is significant in reducing owner stress and thus the domino effect on the patient.
Lovely. See, rehabbers have such great ideas.
All right, Tanya, as a vet professional, how much responsibility do we need to take for the emotional patterns or aspects of the clients? Interesting. We are not psychologists. However, the client's perspectives and experiences of pain directly influence their behavior to their animal companions. What is the role and responsibility of the rehabber in this regard?
And the more you explore this, the more difficult that balance becomes. I think the responsibility of the vet rehaber, and it's always the thing, right? We go into veterinary medicine because we want to work with animals, and that's what we want our career to be. And then it turns out that all animals tend to come with humans attached to them. And if we want to be true professionals and really good at what we do, we have to take responsibility for at least truly understanding that component of it. It's a little bit similar to understanding what goes into a TPLO surgery without being able to necessarily do the TPLO surgery. We have to understand what it is, what happens, what the implications are, and if things haven't gone right, what the potential courses of action are. Our clients certainly don't come to us thinking they're going to get a counseling session. But there are a lot of ways that we can upskill ourselves and improve our communication skills in situations where we suspect that the emotional balance of both parts of the human-dog diet is not what it should be. And that should form part of our commitment to continuing education and improving our skills. So yes, I mean, we certainly are not psychologists, and addressing more complicated, let's call it pain-related baggage. And in one of my later talks, I'm actually going to use an example of this. That is not our role, but we have to understand the effect it is having on our treatment plan and what are some of the things we can do to compensate for that.
Thank you, Ansi. I love that. Jane, thank you. What a great question. Using a laser, as you suggested, can have more effect than one might think if you use acupressure points that are not close to the injury. I love that.
Absolutely. Absolutely.
Charlotte is saying, I have a client who has a dog with severe elbow OA. She wants to do everything for her dog, but when I see the dog, I can feel the anxiety in the owner being transferred into the dog when I'm treating. I feel that the dog would have reduced pain if the negativity of the owner was not transferred across so much. I also try to explain the importance of adapting the environment and exercise, yet despite knowing he is in pain, she always puts up barriers. As vet rehabbers or physios, we need to almost play a counseling role in some circumstances.
We do. And that, like we discussed now in the previous question, that can be really difficult. I love what you said, though, because it's such a good example of social synchrony. And one of the really good studies that demonstrated this was a study where they took therapy dog handlers and their dogs, put them in a room. The handlers didn't do anything with the dogs, but they had to complete this really tricky math test in a short time. That was quite stressful. And then they tested the salivary cortisol in the dogs. And the dog's salivary cortisol went up as the handler stress levels went up. So when we say there's this emotional contagion, it's not something that's made up or, that we like to humanize the animals to say they pick up our stress. They actually physically do, and there's a physiological effect to that. And the fact that she said that she also can pick up on that stress, that's exactly the same mechanism.
I love that. That's so interesting. And Jane's last comment, getting the owner to realize that they are the most important member of the team is critical, I find. Jane, thank you for that.
Absolutely.
Yeah.
What a wonderful lecture and amazing comments and questions. It really got me thinking as well. Thanks, Ansi. Thanks, Anae.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Curacao Vet. Their sponsorship allows us to be able to give this podcast to you for free, so please go and check them out at curacao.org. Please also don't forget to bookmark the next Vet Rehab Summit. It's on Saturday, the 8th of November in 2025. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Online Pet Health members, you get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.